Yeah.
Okay, Brian, I heard you. Can you hear me? Did you hear me? Excellent. Thank you.
Thank you.
I'd like to call the meeting to order. Madam Secretary, could you please call the roll?
Director Deere is absent. Director Ryder is absent. Serving as a substitute member, Director Story
Present.
and Chair Harrington.
Thank you.
You have a quorum.
Thank you. The Audit and Compliance Committee's regular scheduled meeting for 2024 has not yet been determined. However, it is expected that the committee will begin holding their quarterly meeting starting in January 2024. Debbie, is there anyone registered to provide in-person or virtual oral testimony or submitted written testimony to be included in the record?
There were no registrations for oral testimony, and we did not receive any written testimony.
Thank you. Hearing none, we'll go to item 3 on the agenda, a report from the Chief Corporate Compliance and Privacy Training. Ashley Huntington, Compliance Officer, will review the report.
Good morning. I'm Ashley Huntington, CCH Compliance Officer.
Good morning.
Good morning.
I'm filling in today for Nicole Almiro, our Chief Compliance and Privacy Officer. Getting started today, we have our meeting objectives. We're going to have a review of the compliance program, as well as the Audit and Compliance Committee charter. We'll move into the metrics for our department on the system compliance program, and then go into the County Care Medicaid Health Plan, as well as our recoveries. Getting started today, the structure of our CCH compliance program is based on the 7 elements. This is from the federal sentencing guidelines. So each of the activities that we undertake, the main purpose is to prevent violations of laws, rules, regulations, to detect violations as they happen, and then of course to make corrections to any issues that are occurring. Each of those 7 elements falls within the buckets of prevention, detection, and correction. We have focused our efforts most substantially this year on training and education, which can go in the prevention bucket as well as the correction bucket. Some of our trainings have included financial conflicts of interest, the teaching physician presence education, as well as HIPAA refresher training. Our goal year after year is to make sure that we are working hard on these elements and following them to have an effective compliance program. Next is our Audit and Compliance Committee charter. This was last approved on November 16th of 2021. We are asking for your review and approval. This is included in your packets. There have been no edits made to that policy. Moving into metrics for the provider side of the compliance program, we have a graph here that shows the different activities that make corporate compliance go round. The comparison for number of contacts this year, we have approximately 741 unique contacts that have come to our department in the first 3 quarters of the year. This is a substantial increase from last year. Part of the explanation for that is we've had a lot of administrative help with getting our issues into our compliance tracker so that we have more meaningful data this year. The largest increase that we have seen is in contracts, and that is because contracts are being reviewed by compliance before they ultimately go for signature. So that explains the very large increase in that category. Otherwise, the rest of our categories have remained relatively the same.
Has there been an increase in any specific type of contract?
We're reviewing all contracts that come through the system. We specifically review the contract in its entirety, but we also review GC18 for corporate compliance requirements, and then if necessary, a business associate agreement, which is GC39. That's for our vendors who are using, accessing, or disclosing protected health information on our behalf.
So then we're using a lot more vendors. If we have a lot more contracts, I'm wondering where the contracts are. There's a significant increase.
So I believe the increase is due to the overall process by which contracts get reviewed. Previously, contracts were only reviewed by corporate compliance if there were edits to those specific sections. Now all contracts are coming for review. So I can't necessarily speak to whether there's a significant increase to contract volume overall, but we are simply involved in every contract that touches the system, which explains the about 50% that this is making up from our contacts.
Yeah, and there was a decrease in privacy and security, HIPAA?
That's correct. There's a couple ways that we think this might be explained. Number one, we are doing more training. So this is helping our staff make fewer of those little errors, such as discharge instructions going to the wrong patient or prescriptions being sent to the wrong patient in error. So we do attribute some of our training to helping our staff have better checks along the way to make sure those little tiny HIPAA privacy and security errors aren't occurring.
Thank you.
Okay, moving on to the county care side of the house, we have a similar graph here about the contacts for the system. Again, we see that the largest volume of contacts to the compliance program is on the contract side. This is the very same as the provider side. We are simply reviewing all contracts and signing off on them before they go out, so that is the largest increase there. We also have a large volume of fraud, waste, and abuse contacts. You will see that there is a slight decrease this year in contacts to the county care side. We have 431 so far in the first 3 quarters of the county fiscal year. Last year we had approximately 530. The reason that we think that this has happened is HFS-OIG recently rolled out a new portal, which has required a tremendous amount of work on our end to take a look at what we're reporting, how we're reporting, and they've also asked that we report issues that were previously reported. So we had approximately a 2-month backlog of issues that were already reported that had to be re-reported into this new portal. So that explains the slight drop-off in contacts to the county care side for the first 3 quarters of the county fiscal year.
That's just a general question about your efforts and your colleagues' efforts in terms of compliance. How does an individual just, if they have an express concern about a particular contract, can they just contact you all by email or just write a letter or call if you have an answering service and say, what do you all do with those if it's an anonymous? I mean,
yes, absolutely. We do have a number of different ways that anybody can contact us, whether they're a contractor, employee, or a member of the public. We have 2 email addresses, the compliance@cookcountyhhs.org email address, as well as the privacy@cookcountyhhs.org email address. Those are checked regularly by all of our staff. All of our email addresses are also public, so anybody in our department who were to receive an email in that vein would appropriately review it, triage the problem, and work towards resolution and talk through how we would respond to that. So we take those in all the time, as well as phone calls. And we regularly convene meetings if somebody wanted to talk through a contract or talk through any other issue that they may have. We also maintain a 24/7 anonymous reporting hotline that we regularly publicize across the system so that employees know that they have a method to report concerns that they may not feel comfortable discussing with their superiors or bringing directly to us.
thank you.
Okay, moving into the next slide. Let's see. Give me one more over. Yep. One more over. There we go. Sorry. No, that's okay. So this takes a look at our retrospective. On the left-hand side, we have our retrospective recoveries for county care. Looking at the recoveries for this is for the state fiscal year. We have nearly $7 million in overpayments that were collected. This is a little bit more than last fiscal year. I want to note that we can't expect one-to-one overpayments identified to be collected. The initial time between the overpayment being identified versus collected can take anywhere from 6 months to 4 years. So we don't always anticipate a one-to-one recovery rate there. Moving on to the proactive preventive loss side, we have nearly 1.7 million here, very, very similar to last year. The preventive loss is a mechanism to recover or capture mistakes prior to them going out the door. And then just one thing to note, we do have a new pharmacy benefit manager this year, so we aren't entirely sure how this data will be reported and how this will look for future quarters and future fiscal years. And that's all I have for today. Are there any questions that I can answer?
Thank you. I don't have any questions at this time.
Thank you.
Thank you for your time.
We'll now move to, item 4 on our agenda. We have one action item before us, and that is to approve our committee minutes. They were approved by the board at the July meeting, but they're being presented for the committee's review and discussion if necessary. Can I have a motion to accept the motions of the July 21st, 2023 Audit and Compliance Committee meeting?
So moved, Mr. Chairman.
Are there any questions on the motion? If not, all those in favor?
Aye.
Aye. All opposed? Then the motion carries. Oh, yes, I see it. I missed the motion. Sorry. There was a request that we approved the charter. Can I have a motion to approve the proposed Audit and Compliance Committee and, of the Board of Directors charter?
So moved, Mr. Chairman.
Are there any questions? I second the motion. Are there any questions on the motion? Hearing none, all those in favor?
Aye.
Aye. Any opposed? The motion carries. Now we'll move to item 5, that is a closed meeting. The committee will be going into closed session. Action is not anticipated to be taken in open session after the closed meeting has adjourned. Can I have a motion to go into closed meeting?
So moved.
That's pursuant to the following exceptions to the Illinois Open Meetings Act, 5 ILCS 120/2, parentheses C, 1 and 29. The motion has been made and second. Are there any questions on the motion? Madam Secretary, please take the roll call.
Roll call on the motion to go into closed session. Director Deere is absent. Director Ryder is absent. Director Story
Present.
and Chair Harrington.
Aye.
You have 2 yeas and 2 absent.
Thank you. The motion carries. We will now go into closed session.